John Tefft. I live in Harbor Point community here in James since 2005. I had an obvious bulge in my top of my stomach. I came to see Dr. Mullis, and he said that it was clearly a hernia that needed to be repaired. And within 2.5 weeks, we were in the operating room getting it fixed. When I first saw it, it got progressively worse, but it probably was almost a year before I really decided to do something about it. And you could start to see it through my clothing. And that was kind of enough for me. And my wife said, "You need to go see about that," and I said, "I agree."
John had an incisional hernia. John came to see me in regards to a bulge he had noticed after a prior surgical procedure that he had done. Common operation in an older gentleman was prostatectomy, and noticed this bulge was causing a significant degree of discomfort. A very interesting character in that he's quite healthy for his age. He has some early Parkinsonism, but is quite active for an 80-year-old gentleman. And we discussed his problem and approaches that are tailored to get him back to 100% full capacity and enjoying and loving life again, and discussed a robotic repair.
Well, robotic surgery is really very non-invasive. It just really is very quick and easy. I'd had robotic surgery once before for prostate cancer removal, and just very simple. And yet, I was in the operating room that time for 5 hours, and it took me a day to get over it. This time, I was in with Dr. Mullis for about 2.5 hours, and I have not had a single pain. I took one extra strength Excedrin, that's all. And he didn't even prescribe any painkillers. I didn't want them. I didn't need them.
When I met John in the office, he was quite spry for his age. I think he had some degree of hesitancy about wanting another surgery, but he knew that at 80, with some degree of Parkinsonism, he was not ready to call it quits. He is quite active gentleman, and I got a sense of that pretty instantly during our interview. He was willing and ready to have his repair performed, and I offered him a minimally invasive approach in the same day and told him with 3 weeks of good post-operative care, he'd be back to 100%, and that's where he is today.
Well, I'd say from my heart that I have absolutely no hesitation being here today or making the recommendation for anybody to come to this hospital, Dr. Mullis, this surgery center, to the best I can imagine.